Please see full important safety information at the end of this video.
Hi, I'm Dr. Lisa Masterson, and I'm an obstetrician gynecologist based in Santa Monica, California. Today, I'm here to talk to you about morning sickness and ways you can manage it. Morning sickness in the medical community is known as nausea and vomiting of pregnancy. However, the symptoms don't just include nausea and vomiting. They may also include gagging and retching. All of these symptoms can range from mild to severe. Morning sickness is actually extremely common. Up to 85% of pregnant women will experience nausea and/or vomiting, and for the majority of these women, symptoms can last well beyond just the morning. Symptoms of morning sickness can present as early as 4 to 6 weeks after your last period, usually peaking around the first 10 weeks of pregnancy. For most women, these symptoms will resolve by 14 to 16 weeks. However, for some women, these symptoms will continue throughout their entire pregnancy. Morning sickness is a real medical condition. If you're suffering from morning sickness, timely treatment is essential, as it could prevent your symptoms from getting worse. Delaying treatment may lead to weight loss and dehydration, which could require hospitalization. So talk to your healthcare provider as soon as possible about any morning sickness symptoms you're experiencing. He or she will suggest diet and lifestyle changes to help you manage your symptoms. And if diet and lifestyle changes don't get your symptoms under control, then it may be time to ask your healthcare provider if Bonjesta is right for you. Bonjesta is a fast-acting, long-lasting prescription medication that is FDA-approved for the treatment of morning sickness when conservative management, like diet and lifestyle changes, fails. And it contains a combination of ingredients that have a 60-year-plus safety record for both mother and baby. The most common side effect of Bonjesta is drowsiness. Bonjesta has been designed to control your morning sickness symptoms continuously, day and night. You take one tablet at bedtime, and then, if your symptoms are still not adequately controlled, another one in the morning. It's that simple. Ask your healthcare provider if Bonjesta is right for you and get back to being you.
Bonjesta is a prescription medicine used to treat nausea and vomiting of pregnancy in women who have not improved with change in diet or other non-medicine treatments. It is not known if Bonjesta is safe and effective in women with severe nausea and vomiting of pregnancy, a condition called hyperemesis gravidarum. Women with this condition may need to be hospitalized. Bonjesta is intended for use in pregnant women. It is not known if Bonjesta is safe and effective in children under 18 years of age. Do not take Bonjesta if you are allergic to doxylamine succinate, other ethanolamine derivative antihistamines, pyridoxine hydrochloride, or any of the ingredients in Bonjesta. Please refer to the patient information leaflet for the complete list of ingredients. Take monoamine oxidase inhibitors, MAOIs. Ask your healthcare provider or pharmacist if you are not sure if you take an MAOI, including Marplan, Nardil, Emsam, Eldepril, Zelapar, and Parnate. Before taking Bonjesta, tell your healthcare provider about all of your medical conditions, including if you have asthma, have eye problems called increased intraocular pressure or narrow-angle glaucoma, have a stomach problem called stenosing peptic ulcer or pyloroduodenal obstruction, have a bladder problem called urinary bladder neck obstruction, are breastfeeding or plan to breastfeed. Bonjesta can pass into your breast milk and may harm your baby. You should not breastfeed while using Bonjesta. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How should you take Bonjesta? Talk to your healthcare provider about how much Bonjesta to take and when to take it. Take Bonjesta every day as prescribed by your healthcare provider. Do not stop taking Bonjesta without talking to your healthcare provider first. Do not take more than 2 tablets, one in the morning and one at bedtime each day. Take Bonjesta on an empty stomach with a glass of water. Take Bonjesta tablets whole. If you take too much Bonjesta, overdose, you may have the following symptoms: restlessness, dry mouth, the pupils of your eyes become larger, dilated, sleepiness, dizziness, confusion, fast heart rate, seizures, muscle pain or weakness, urination changes, and buildup of fluid in the body. If you have these symptoms and they are severe, they may lead to death. If you take too much Bonjesta, call your Poison Control Center at 1-800-222-1222. What are the possible side effects of Bonjesta? The most common side effect of Bonjesta is drowsiness. Do not drive, operate heavy machinery, or do other activities that need your full attention unless your healthcare provider says that you may do so. Do not drink alcohol or take other CNS depressants such as cough and cold medicines, certain pain medicines, and medicines that help you sleep while you take Bonjesta. Severe drowsiness can happen or become worse, causing falls or accidents. Bonjesta may cause an incorrect positive result for urine drug screening tests for methadone, opiates, and PCP. These are not all the possible side effects of Bonjesta. Call your doctor for medical advice about side effects. Keep Bonjesta and all medicines out of the reach of children. Carefully read the storage instructions as detailed in the Bonjesta patient information leaflet. Duchesnay USA encourages you to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.